My name is Justin Burwinkel, and I'm a senior research audiologist at Starkey. I've been here for about 10 years, and in that time I've seen the hearing aids go from the Halo, which was one of the world's first hearing aids that connected to smartphones, to Edge AI now, which has not only fall detection, but balance assessment, which are two features that I've had the privilege to work on. When I first started at Starkey, I was looking at things like the perceptual impacts of increased processing capabilities and the delay that increased processing might put on an audio signal and how that's perceived by listeners in various different situations. But a big focus for me over the past few years has been on our falls risk reduction technology, which has spawned features like fall detection and balance assessments. Starkey was the first and remains the only hearing aid manufacturer to offer any of these fall-related features. Yeah, there are a lot of connections between balance, hearing loss, and increased falls risk. The fact that hearing loss requires us to listen more intently, use our minds to fill in some of those gaps in our hearing. So divided attention can impact our ability to safely navigate an environment when we have hearing loss, as well as the fact that hearing loss sort of cuts us off socially and in some ways change our behaviors to lead to less physical activity and more frailty, which also results in higher rates of falls. We know that from research that there is a 40% increase for every 10 decibels of hearing loss that an individual patient experiences. So even a patient who might have a mild degree of hearing loss can be as much as 3 times more likely to fall than an age-matched peer who doesn't have any hearing loss at all. In the US alone, there are 36 million falls every year, leading to more than 3 million hospitalizations and 32,000 deaths. After someone experiences a fall, they're more likely to fall again. We know that if a patient is hospitalized due to a fall, that within the next year, 50% of them will pass away. And even 1 week in the hospital can lead to 10 years worth of natural muscle loss. It's funny you use the word ground zero because I spent a lot of time on the ground when we were developing the fall detection feature. For the fall detection feature, we had to develop AI that could recognize, based on inputs from motion sensors embedded in the hearing aids, that a fall has occurred. But we also had to teach the AI what a fall didn't look like. So we did simulations in the lab of me falling, among others, as well as taking those sensors out into the real world and just performing everyday activities, exercise, you name it. The fall simulations that we performed in the lab were not just Hollywood simulations, but they were informed by real-life video recordings from within nursing facilities that showed us how older adults actually fall. Once we were able to develop an initial prototype algorithm, we embedded that into a research hearing aid, which then we could wear out into the field. We had our patients keep a diary based on this rudimentary fall detection algorithm. And any time that it went off, they recorded into their diary what actually occurred. And when they came back to visit us, we would download that data and know exactly what happened. In most cases, they weren't actually falls, so we could use that to train the algorithm to know what wasn't a fall. And over the years, we have built on additional layers of machine learning to our fall detection system to further improve its accuracy. So while we were testing, older adults going out into the real world and coming back to us with, their false alarm fall detections, during those lab studies, we were putting them through the CDC's STEADY initiative, where we were asking them questions about falls risk factors and having them perform gait, strength, and balance exercises to help us understand how they would perform on those tests. So we've used all that data, going back the 7 years that we've been working on these features, to really enable us to now release the balance assessment feature. The balance assessment feature is a one-to-one implementation, really, of the CDC's STEADY initiative, which includes 12 screening questions to identify those potential modifiable risk factors, as well as functional gait strength and balance tests. That being said, the balance assessment feature is not intended to replace the cross-functional assessments that physicians, pharmacists, and therapists can provide a patient in person. I think the next big opportunity for us is really to take everything that we've learned through the development of the fall detection feature and the balance assessment feature and integrate that into a balance retraining app, to help people to take the exercises that their physical therapist gives them and to, one, remind them to do it, two, encourage them to do it, and three, provide them real-time feedback as they're doing it to keep them on schedule and moving in the right direction. I think there'll also be an opportunity for us to provide other types of real-time alerts. Things like if a forgetful patient stands up, to remind them to use their walker or cane. Or if someone experiences lightheadedness when they stand up, to just sort of let them know when their blood pressure is starting to level off before they begin walking again.